Thank you, Taoiseach. As we proceed through the accelerated roadmap and people begin to look towards normal life, or as normal as it can be, summer holidays and travel become a big focus of that. In the sea of what has been confusing messaging on a host of measures, not least face coverings, Andrew, you've addressed that to some degree now, it's fair to say that people are also confused about the realistic prospect of air travel or not in the near future. Michael O'Leary has been omnipresent, telling everyone who listened that Ryanair have everything sorted and are restoring 40% of their flights from the 1st of July. They're proudly announcing on their website that travel restrictions are lifted and they're open for holidays from $39.99. Yet, I had a good look at the website and nowhere does it reference our own government restrictions which have been imposed regarding the need to self-isolate for 2 weeks upon landing, or the fact that we now have a mandatory form to complete, that you would give an address that you may be contacted at. I think we have to be realistic in suggesting that someone who goes off on a week's holiday, are they really going to take 3 weeks off and isolate themselves for 2 weeks and not return to work? Similarly, someone on a business trip for a few days, I think we have to be realistic about this. From July the 1st, the scale of this issue becomes much bigger. I think we'll all agree that had travel restrictions been in place in March, when we had a large influx of visitors from northern Italy, we may have had a considerably reduced number of infections, and indeed we may well have had avoidable deaths. The aim of the roadmap is to reopen as much as possible, as soon as possible, as safely as possible, and that's fine. But a quick, reliable method of testing and tracing becomes critically important in not regressing. So we need to carefully manage risk, and travel is one of the main risks. We were told last week in this House by the Minister for Transport that social distancing will occur on airlines where possible. Where possible could mean limiting the number of passengers or separating people where the flights are not fully booked, but where they are fully booked. But ultimately, who decides that and how is it policed? Are we happy that those decisions are being made by a particular airline? Or are there plans have the government plans to manage this? Michael O'Leary's business is flying people and making a profit. Our business is about keeping people safe. The two are not necessarily in keeping with one another. The fact is that we cannot be complacent about the potential growth of the virus becoming a resurgent. In the US, for example, just 6 weeks ago, there were 7 states where the R number was greater than 1. Today, there's 15 states where the R number is greater than 1, and that signals that the virus is expanding. In Britain, the UK top government scientists appear to acknowledge, at least in private, that the R number appears to be above 1. But there's daily flights being advertised from the 1st of July to London, Birmingham, Manchester and many other UK destinations. With a small number of flights, it's possible to test and trace, but if that's scaled up dramatically, then it requires a significantly scaled up testing and tracing operation. And who's going to do that? Is that being planned for? When it comes to testing at airports, bear in mind that hospitals do tests and give results within 10 minutes from start to finish. Is that an option? And if so, is that being used? Could that not be used in other settings? Is it cost? Is it tests? I wonder, is it about reliability when hospitals see them as reliable tests? There's talk of air corridors, and there's also places and locations where testing is done in airports. So what is the approach? In addition to the confusion about face coverings, although that seems to be fairly clear in relation to air travel, we're being told that they're going to be mandatory on flights, but how is that going to be policed? There's nervous flyers, there's children on flights and things like that. It's very mixed messages. So we know that the ideal would be to eliminate the virus, but failing that, the best we can do is to manage it and to keep it to an absolute minimum. So, Taoiseach, travel is such an important part of that, and our airlines are a really important industry, and I want to acknowledge that, but they have to operate safely. So who is making the decision on this Taoiseach? Is it been made by the airline? Or is the government having a role? Is the government, policing this? And how is it going to be managed? And will you tell us, with increased flights, how is it intended to manage the risks? Is that going to be scaled up? Who's going to do it? Is it not also self-evident that testing at airports and ports is going to have to happen?
Thanks, Deputy. To answer your question, decisions will be made by government, not by individual airlines. But the decisions we made will, of course, be coordinated with the European Commission and also EASA, the European Air Safety Authority. And we do need to bear in mind that we are all EU citizens, and EU citizens have the freedom to travel, work and study anywhere in the European Union. We can bring in limitations based on public health, but they have to be justified. In terms of foreign travel, and by foreign travel I mean travel off the island of Ireland, our advice is that people should not engage in any unnecessary travel. And I think the message is clear. It's there anytime you turn on the TV. Stay local. Don't leave your county, or don't go more than 20 kilometres from your home unless you have to. So that certainly says don't travel abroad. Anyone entering the country to our ports and airports has to sign a passenger locator form. It is an offence to fill it in falsely, and people are then strongly advised to self-isolate for 14 days. The plan is to establish air bridges with other countries that have a similar level of viral suppression. We haven't agreed any of them yet, but that is the plan. In terms of testing at airports and ports, consideration is being given to that, but there are real limitations. First, there is the cost of the test, which is not low. Secondly, there is the inevitability of false negatives. People in the early stages of the disease may not test positive, but may be spreading it within days. And then there's also the fact that a 14-day self-isolation is still the safer option.
The advice we heard last week from the Minister for Transport that the social distancing on flights would occur where possible. Is there limits on the number of people that are allowed to board a flight? And if not, is it really possible if the flight is full? Because we saw a number of weeks ago, we saw an Aer Lingus flight from Belfast, and we saw photographs of that at the height of the pandemic here, and that's the kind of thing that we're likely to see. Look, the thing about it is that we all want the least amount of restriction, but there has to be where there's so much effort has been put in from people, not least frontline workers, people who have cocooned for months. We can't ignore the risks from particular locations where the R number is high, and that has to be managed. And it doesn't feel to me where you turn on the radio and you hear the advertisement almost on the same group of advertisements about the government restrictions. But we've got to remember that flights go in two directions, and there will be people coming to this country from locations where there is a higher rate of infection than there is here. And it's how that's managed that is critically important. And can you tell us about the scaling up of the testing and tracing in the context of an increased number of people who are coming into this country by airports and ferry ports?
Thank you, Deputy Speaker. Conclude, please.
Thanks. Like we have very considerable testing and tracing capacity now. The capacity to test 100,000 people a week and to trace many thousands of people. It's not being used at the moment because of the low level of demand for it, but it can be used if we need to do so in the future. And that's really going to be the future, is making sure that we have a very strong testing and tracing capacity so that any imported cases and any new clusters are identified quickly and can be stamped on quickly so that they don't spread and so that we don't have to engage in any more lockdowns. I think what the Deputy says is absolutely correct. Social distancing on planes, and not just in planes, in airports. would be extremely difficult to achieve. So that's another place where you're probably going to be into advising people to wear masks, because social distancing won't be practical. In terms of air bridges, we don't have any yet, so that's why we're advising people not to come here and not to fly out of the country. But just giving an idea of the kind of countries where there's a similar number of low cases as us, 16 in Ireland yesterday, Finland 15, Greece 10. Countries like that, the number of new cases is very low, and therefore the risk of journeys between those countries would be very low. But it can change quickly. We thought Portugal was one of them, and there were, I think, 400 cases in Portugal yesterday. So it's a changing picture even still.
Thank you very much.